Hello guys, so we're back again this week with all around health talk, and as usual my name is Dr. Onyinye and with me is
Dr. Celestina.
Okay, so last week we talked about high blood pressure, we talked about definition, risk factors, symptoms. Today we're going to continue with diagnosis, complication, treatment and prevention. So for us to be able to properly diagnose hypertension, we need to be the kind of people who go for routine checkups. Okay, like we mentioned last week, high blood pressure is basically asymptomatic, which means no symptoms. So you don't feel anything that makes you feel like I should go to the doctor to check my blood pressure. If you're not the type who goes for a normal blood checkup regularly, then you might not have your diagnosis on time, and by the time it's diagnosed it might be really advanced. So first of all, you need to be the kind of person who goes for a regular checkup. Now, for us to diagnose hypertension, we have to understand the two numbers that the doctor always writes for us. Okay, because when you go hospital, doctor they write, when you measure your blood pressure, you go write two numbers, one number on top, one number under, or one number first and one number second. As we talked for our last video, the first number now the pressure where your heart they use pump the blood when it contracts. Okay, so that pressure when they use contract now be the first number where your doctor they write. Now the second number where your doctor they write now the pressure where your heart they use receive new blood when it relax. That's after you don't finish with the contract, they pump the blood, it go come relax so that new blood go enter. Now that time when new blood they enter, the pressure where they use they receive that new blood now the doctor they write as the second number. So normally when your heart is contracting to pump blood, it uses more pressure than when it's relaxing. So that's why every time you see that the first number is higher than the second number. So that's first number with the doctor they write now waiting with they call for medicine systolic blood pressure, and the second number with the doctor they write now waiting with they call diastolic blood pressure. So when your doctor mention those kind big words, you go know say now waiting we don't explain already contraction and relaxation of your heart. Okay, now how will they diagnose this high blood pressure? If you happen to be in a hospital and maybe your doctor measure your blood pressure, it can say the number high past normal, he go tell you say may you come back for successive days, maybe 5 continuous days or 7 continuous days at the same time. For example, if you go by 4 p.m. today, your doctor check your blood pressure, it high. For him to be able to diagnose you, he go tell you, yeah, come tomorrow by this same time, come next tomorrow by this same time, for 5 days continuously or for 7 days. It depends on your doctor's judgment. Okay, now at the end of these 5 or 7 days, he's going to compare the numbers and then decide if you're hypertensive or not. Okay, so basically on a normal day, that's how you diagnose high blood pressure, but there are exceptions. For example, if you are above 65, you're 80 years old, maybe you have diabetes, you have other diseases, or you have other risk factors that we mentioned in the last video, based on that your doctor can use just the first measurement of your blood pressure to diagnose you. That means your blood pressure has to be really higher than 140/90. Okay, so generally this is how you diagnose hypertension. Now there are other types of hypertension that need like a different touch to it. For example, we have what we call in medicine white coat hypertension, which is basically that this patient has high blood pressure only when there is a doctor or a nurse, which are the people who wear the white. Okay, so when he sees those white, probably he gets anxious, he or she gets anxious, and when they measure his blood pressure, the blood pressure is high. But when this person goes home, he measures his blood pressure at home, his blood pressure is normal. So for the doctor to be able to decide if you're hypertensive or not, he's going to place you on a kind of measurement of blood pressure that requires a handcuff. So he's going to place it there. It's going to be for 24 hours. So within that 24 hours, you're going to carry out your activities normal. You wake up in the morning, you go to work, whatever you do on a normal day, and that cuff is going to register your blood pressure every 15 to 30 minutes, and based on that your doctor will be able to tell if you're actually hypertensive or you're just anxious when you find a doctor or a nurse close by. There are other people who have the opposite, which we call the maxed hypertension. These people, when they're in the presence of a doctor, the blood pressure is normal. When they go house, blood pressure will come rise. So we don't know whether na stress for house or problem with madam for house or oga na im dey cause the high blood pressure. So that one too, doctor will come tell you, yeah, come hospital for certain days more, they check your blood pressure to decide whether you get hypertension or not. So basically this is how you diagnose hypertension. It's not a big deal. Just measure the blood pressure, and with that you can tell if a person is hypertensive or not.
So the next thing we're going to talk about is complications, right? As we've mentioned in the last video, high BP affects every organ in your body, right? It leaves no stone unturned. It can affect your brain, it can affect your heart, it can affect your kidneys, so on and so forth. It can affect everything, your eyes, everything, right? So the first thing I want us to understand is that we talked about the arteries, right? It's like a pipe that runs throughout your whole body. Every nook and cranny in your body has an artery, right? Because it is through these pipe-like structures that the heart can pump blood to every organ for them to do their work. Right now, if there's any kind of blockage, right, in these arteries that kind of reduces the space that the blood uses to pass through, it can cause a big problem. And high BP is actually one of the diseases that affects those arteries, causing there to be injuries and which can later cause blockages due to accumulation of things like fatty substance, or even blood cells too can accumulate there, right, thereby blocking the space in between the arteries. So this can form in any artery of any organ of your body, right? And when this happens in the arteries of your brain, you can get things like stroke, even make you paralyzed self, go on they do the normal function way you supposed to do. Maybe if it affects the part of your brain where they control you to walk, you go feel walk. If it affects the artery for the part of your brain where they're responsible for you to talk, go feel talk, that kind of thing. If it affects your heart, if it give you like heart attack, heart failure, where we go start to talk about heart transplants, that kind of thing. If it affects the arteries of your kidney, you will start to also get kidney wahala, where your kidney no go fit do the normal work way it's supposed to do, right? Before you know it, we talk about kidney transplant, we talk about dialysis, or that kind of thing. So if it even affects your sexual performance, if it affects your eyes, so if it affects many other organs for your body, this one not just the few we go mention for this video, so we supposed to be very careful when it comes to high blood pressure, because some kind of obonge silent killer.
Okay, so we're going to continue with treatment. How do we treat high blood pressure? First of all, we have to break it to you that high blood pressure doesn't have a permanent treatment. When you have high blood pressure, it's for life, so it doesn't have a permanent treatment. It means that you have to take your medication every day till the day you die. Okay, so this is very important. Now, how do we treat high blood pressure? Treatment of high blood pressure is not only about taking your medication. There are so many people that prefer to think that treatment is only about medication. No, medicine doesn't. In every situation, the tablets, the medication, the injection, whatever they're giving you doesn't work alone. You need to change your lifestyle. So the first thing for high blood pressure is lifestyle changes. Now, what are the lifestyle changes? We've mentioned the problems in risk factors. Now you just have to know what to do to avoid those risk factors. For example, one lifestyle change is diet. We're not saying that you should go and do like some crazy diet when you no go fit chop anything. No. For this diet, wetin we need be say make you dey chop more vegetables, make you dey chop more fruits, okay? Because those ones get vitamins, they fit nourish your body well pass all those carbohydrates wey we dey pack dey full for body, especially for Nigeria. We dey chop swallow die, and this carbohydrate is not really good. We have to eat carbohydrate, yes, but we have to know the quantity, not be every day. So for your diet, basically you need more vegetables, more fruits and fibers, okay? So control the carbohydrate level and try to eat much more vegetables and fruits. Another lifestyle change is exercise. We don't talk and tire. You need to do exercise. No be gym. It's not necessary to go to the gym. Take a walk 30 minutes every day, 5 days a week, and you are good. Okay, exercise is very good for your body to function very well. Another thing we need to do is avoid smoking. We need to quit smoking. If you're a smoker, you need to try to quit smoking, because smoking is just really bad for everything. For everything, smoking is bad. So if you're a smoker, please try to quit smoking. If you take alcohol, please try to reduce the quantity of alcohol you take. You don't need to take alcohol every day. Okay, you don't need to take more than 2 bottles at least in a day. Pity yourself, okay, because this just is going to increase your risk, not just for high blood pressure, for other things.
Other stuff, yeah.
We've been mentioning alcohol from the beginning of this video. It's really not good. And another lifestyle change is your salt intake. Okay, like we've said in the last video, we like to put salt, we like to put so much condiment, we like our food to be tasty, right? But too much salt, the sodium is not good at all. Okay, remember that salt is basically sodium and chlorine, but sodium. The sodium is not good for your heart, so you need to reduce your salt intake. If you're a kind of person who takes a lot of salt, there are some things that you don't need salt in, and even if you need salt, just a pinch, a little quantity of salt is enough for you. So these are the lifestyle changes that we're supposed to take into consideration. After lifestyle changes, we have now the actual medication. But remember, the medication will only work with the lifestyle changes. If you're taking medication, you're still doing everything you're not supposed to be doing, you're not helping yourself. Okay, so for the medication, there are so many medications that you can take for high blood pressure, but this will depend on your doctor. Based on what your doctor sees when he attends to you, he'll decide what kind of medication for high blood pressure you need. I know most people know about diuretics. Diuretics will help you by making you pee a lot. It will reduce the pressure that way, and there are other drugs that have so many different functions. But based on your risk factors, based on your race, your skin color, based on other diseases you have, your doctor will decide whether it's diuretic or any other one that is better for you. Another thing we need to do is that once you are hypertensive, make sure that you always control your blood pressure, which means try to make sure you measure your blood pressure frequently. If he's going to the hospital, if he's buying the hand cuff that measures the blood pressure, if you have a doctor in the house or a nurse who can help you measure, it's very important to make sure that you're controlling your blood pressure. That way, if it's still increasing with the medication, the doctor will now know if he should change the medication or if he should add more medication to what you're already taking. So it's very important to control your blood pressure.
The last thing we're going to be talking about is prevention, right? We've all heard this expression that says prevention is better than cure, right? In this case, when we talk about prevention, we actually have like 2 branches: prevention of the hypertension itself and prevention of the complications due to hypertension. Now, the first case is actually for those who don't have hypertension yet, right? It's a lot similar to what she has already said, right? Your diet, reduce your salt intake, you have to exercise, right? Even if you take a walk, or you don't really need a gym. Even in your house, you can just do 15 minutes light exercise, depending on what you like. You can even choose what you like, so long as you're moving your body. This helps to reduce your blood pressure, which is actually one of the benefits of exercise. Like all these athletes you see who exercise every day, there is actually one thing common with them: they have low blood pressure. So sometimes you even go to the hospital if you're an athlete or you exercise a lot, and the doctor takes your BP and he sees that you have a low blood pressure. The first question they'll ask you is, do you exercise a lot, or are you an athlete? That's actually one of the benefits of exercise. It reduces your blood pressure, thereby reducing the risk of getting complications due to blood pressure. Okay, the next prevention method is rest, right? The body is like a machine. Now imagine if you were to overwork a machine over time without actually giving it a breathing space to rest. What do you think is going to happen to that machine? It's going to break down, and that's exactly how our body reacts to stress, especially when you don't rest enough. That is very important in order to regulate your blood pressure. When you rest more, you are able to better manage your blood pressure. Now, for those who are already living with high BP, what we have to focus on is prevention of complications, right? As we've said, high BP is mostly asymptomatic. You don't really feel the signs and symptoms of high blood pressure, but a way that we can control the development of complications if we stick to the regular checkups that we're supposed to be getting, right? Don't say I am fine or I am cured, like no high BP again. Don't say that, please. If you have been diagnosed with high blood pressure, please take your medication regularly and go for regular checkups so that you can keep track of your blood pressure. So that's it for prevention of complications. And please, on the last note, if you notice any of the signs that we've mentioned in the last video, right, please contact your medical doctor. Go to the nearest hospital, right, and get checked out. Do not wait for bad luck to catch you at home. When you start feeling all those things, please go to the hospital to get checked out and treated, right? So that's all we have to talk about today, and we hope that you've learned a lot from this video. Please and please pay attention to this information. High BP is very, very important. It is deadly because it is silent, right? So let us try to take action so that we can better our health and our quality of life. So our next topic is going to be measurement of blood pressure. This is actually very important for those who are interested in learning how to take their blood pressure, especially if you have the machine at home. It's also very important for medical students if you guys want to learn, those who are still starting the journey. So tune in next week for the video. Don't forget to like, don't forget to subscribe, don't forget to comment, ask your questions, just give it to us. We're ready and we're waiting to answer you guys. Continue giving us feedback. Like, we love your feedback. We love everything you have to say, everything you have to tell us. Just keep it coming. Keep it coming. And see you next video. Bye.